All right, guys, we're going to go over some tests that are looking for lesions of the labrum in the shoulder. So how we classify lesions on the shoulder is going to be with a clock. All right. So on the shoulder, looking at it for the labrum, noon, 12 o'clock is going to be the superior, 6 o'clock is going to be inferior, and then on the right shoulder, 3 o'clock is going to be anterior, and 9 o'clock is going to be posterior. And then 3 and 9 o'clock will switch. They'll be opposite on the left side. So on the left side, 9 would be anterior, and 3 would be posterior. So with that clock, keeping that in mind for the labrum, if the tear is up here between 11 and 1 o'clock, that is going to be classified as a slap lesion. And if the tear is anterior inferior, down here between that 3 and 6 o'clock on the right shoulder, that is going to be a Bankart lesion. So while we're going through these special tests, when we find symptoms, we're going to want to try to make sure we're remembering where we are, where we're putting pressure on the labrum so we can classify where the lesion is. So first we're going to go over the Clunk test. We have Clunk 1 and Clunk 2. So for Clunk 1, we're going to have the patient abducted. Their elbow is going to be bent like this because we're going to be taking their elbow and we're going to be placing our right at our hip line, and we're going to be using that to create a force through the humerus into that shoulder. So go ahead and place that elbow there, and then with your other two hands, you're going to go ahead and grab the proximal humerus right next to the humeral head. And then once we go, we're going to create that pressure in, and then we're just going to rotate that humerus clockwise and counterclockwise in that shoulder joint, putting pressure all the way around on the labrum. And a positive test for this is going to be either like a pain, clicking, popping, or catching sensation felt in the shoulder. And again, if we do have those positive signs, make sure you know where you're feeling them so you can help classify where the lesion is. For Clunk 2, we're going to bring the patient, we're going to start him down here. We're going to have one hand supporting at the elbow. Our other hand, we're going to place underneath the shoulder joint, right underneath that humeral head. And we're going to create an anterior translation, anterior force pushing straight up on that humeral head. And then while we're holding that anterior force, with our other hand, we're just going to be taking them and we're moving that elbow down, pushing it down, and we're going to move all the way through a range of motion of abduction, all the way up, all the way through. And then as we're doing this, remember, if we're between this region and this region, we're putting stress on the anterior inferior part of the labrum. So if we have pain, clicking, popping through from here up to here, that would be a good indication of a Bankart lesion. And finally, our last test is going to be the crank test. So while we have our patient up in this position, about 140 degrees of abduction, we're going to hold them there. With one hand at the elbow, we're just going to create a force through the humerus into that shoulder joint. And with our other hand at the wrist, we are going to move him into internal rotation. And this is going to be putting pressure on the superior part of the labrum. So if we have any of our positive signs of the pain, clicking, popping, or catching, that would be a positive sign indicating a slap lesion of the labrum.